Okay, I think we'll get started. It's just about 1:04, and if people jump in, I'll let them out of the waiting room to join us. But I wanted to welcome everyone to today's conversation with the Sustainable Change Alliance Foundation with County Supervisor Dos Williams. I am a founding board member of the SCA Foundation, and I'm the head of sustainable investing, sustainable investments with Argyle Capital Partners. I'm also extremely proud to say I'm married to an emergency room nurse who is on the front lines of this pandemic and has a unique perspective. So I'm very interested to hear the conversation today. The Sustainable Change Alliance Foundation, just for everyone's background information, is comprised of a number of local professionals that support impact investing through engagement and events and education. And the foundation really is in the solutions business, where we work to harness the power of private, nonprofit, and public sectors to address environmental and social problems. I'd like to acknowledge the hardworking and dedicated Sustainable Change Alliance Foundation board members, many of whom are on this call, as well as our members for joining us and becoming official members of Sustainable Change Alliance Foundation. And then to acknowledge our sponsors, our founding sponsors, beginning with maps.com, Argyle Capital Partners, UBS, our platinum sponsor being Nixon Peabody Law Firm, gold sponsor JP Morgan Chase, and our silver sponsor is Brashears Insurance. And if you're not a member of the Sustainable Change Alliance Foundation yet, we encourage you to join us on this journey. And you can do so by just going to sustainablechangealliance.org and signing up. So the logistics here for this meeting are pretty simple. It is being recorded. You can probably see that in your upper left-hand corner of your screens. Everybody's on mute, as you can see. And oh, here comes Pamela Grattan, excuse me. And Dos is on, his speaker is unmuted, as is my own for now anyhow. And then when Dos is done with his comments, we're going to open it up for questions, but we'll do that through the chat feature. So if you can see the bottom of your screen, if you haven't done it before, there's a chat button where you can type in questions for Supervisor Williams. I had a handful of data that I was going to put up or just share with you guys, and I just saw a presentation that Dos is going to share with us, so I'm going to forego that. He's got much better, much more current numbers than I do. And let me just say a quick word. Dos, as many of you know, was elected to the Board of Supervisors in 2016. And prior to that, he was an assembly member representing the 37th District of the state of California. He also served prior to that, as many of you recall, I'm sure, on the Santa Barbara City Council. And he has a master's degree in environmental science and management from the UC Santa Barbara Bren School, where he focused on the planning process, water pollution, and land use law. With that, go ahead and take it away for us, Dos.
Well, first, I just want to say what an honor it is to be invited to speak. You have some old friends and some new friends in your group, and definitely some folks who I'm inspired by your tendency to want to unify business and environmental change, and this is, I think, very relevant to the challenge in front of us. And so you might think that my presentation or my talk is just tailored for you guys, but no, it's actually really what I've decided I want to spend probably the next year focusing and talking about. And so first I'll I'll sort of tell you where we are right now, and that what we are, well, just so you know, one of the things I tell people, and what Stephen left out of the his bio, is everything I learned about fighting evil, I learned from Lord of the Rings. So one of the things that I think is really relevant for the times that we are in is the conversation at the beginning of the book between Gandalf and Frodo. Gandalf basically says, this little ring that you guys thought was really neat that you've had as a family heirloom, turns out it's a super weapon for evil, and that everybody's going to be looking for it, and if it falls in the wrong hands, disaster for all of the world is at hand. And like any rational person, Frodo reacts like, oh my gosh, why me? I wish it wasn't me. And Gandalf very wisely says something to the effect of, we don't choose the times that we are in. The only thing we can choose is how we react and what good we do in those times. And I think that's a pretty important thing for us to remember as we are doing this. So maybe Stephen, you could put up that first slide. We are in a situation right now where you guys have all seen the typical curve of infections, where we are at the tail end of the curve. And we'll go to the graph now. This is important. This is a total cases in orange, active cases in blue, and recovered in green. It is a little bit misleading whenever you see a graph these days in California or in Santa Barbara that only goes up. It doesn't really completely give you the picture, because it looks like we're still rising. Well, we're not at this point. So if you look at the data carefully, is the narrowing that's taken place from total number of cases ever and the recovered, right? So our total, therefore, the delta between that is the active cases. Our active cases are falling. And so you guys have been used to seeing a whole lot of, bell curves. First of all, we never really had a bell curve. We had a very flattened arithmetic curve and no geometric growth in number of cases. That's really good. And secondly, you can see from the daily cases or from the number of active cases or even by the hospitalizations that they are happening with fewer number of folks. So we are at the tail end of the typical curves that you've seen. And because of that, and because of the other effects of this, so this isn't all good news, right? We've been enormously successful at flattening the curve, but it's come at terrible cost. And what do I mean terrible cost? Not only those that we've lost from COVID, but the businesses that might shutter either temporarily or permanently, the people who are laid off, the people that may slide into poverty. And I think when we are looking at this and as a public health thing, we also have to balance it with the view that poverty, both through adverse childhood experiences and through other manifestations, has a dramatic public health effect as well, particularly a public health effect on children and on dramatically reducing average lifespan of those children. And so I think it's pretty important for us to look at the growth of poverty also as a public health issue. And so that is the terrible cost of our success. And so therefore, looking at both of those factors, we are right now looking at what plan do we have to put together in order to reopen. And the most, the things that you're going to see very soon. Number one, last week at the Board of Supervisors, we approved a contract with an organization to put together a draft plan for us. That will come in its draft form to the Board of Supervisors. They are right now taking a lot of input from businesses, predominantly from businesses, but also from nonprofits and other entities. And that will come to us probably not this coming Tuesday, but a week from this coming Tuesday at the Board of Supervisors. Of course, we can only open up a few sectors without the state order changing. So the other thing that we are looking at is when the governor will lift the state order or modify the state order. And we are really putting an emphasis on how do we do this safely? How do we maintain social distancing at businesses after they are open and get people to take this really seriously? And the reason is because, that'll lead me into what things went right in all of this. Maybe you could do the second slide or the third slide. This is our case numbers, just further evidence of really that the response, there was something that happened right in Santa Barbara County. And I would argue in most of the state of California, particularly if you took out of the data the federal prison. Now, I'm a believer that even if somebody's in prison, they're part of your community. So this isn't a civil rights question, but in terms of a public health infection question, if you take out the data of the prison, the picture looks even better in terms of where we are moving forward. Next slide. We'll get into that in a little bit, so maybe we can stop sharing for a little while so you can see my face and I can see yours. So have you guys noticed that if you read a California headline in the last month, it's why wasn't California more prepared, right? But if you read a national headline, it's why is California so much better than New York, right? And I think that's very interesting, the juxtaposition if you compare those two, because there are definitely things that went right and things that went wrong. And I would say first, what went right was compared to other communities in the Western democracies, a fast and vigorous response, okay? And I'm just not going to put California in the same category as states that don't have our level of freedom or mobility, because I just think it's not a comparable thing. But in comparison to other states or other Western democracies, we did have a fast and vigorous response, and the curve and the numbers sort of show that. I think the other thing that's really important is that we had really good community cooperation. Now, every day I have people calling, or email on me, telling me we need to clamp down on this beach or that trail, or we need to do this or that, or we need to reopen the economy entirely. Every day I have people agitating for one or the other. But they both miss a really important point, which is that this hasn't happened because of government's coercive power. This has happened because the community has bought into the health orders. We simply in this society do not have that amount of coercive power vested in government. None of this stuff would have happened if we had just issued a health order and people had just gone about their normal lives waiting for them to be told to stop doing things. The fact is, people on the majority, most cases, vast majority of cases, altered their behavior to either a maximal amount or a moderate amount. And that's why we're in a better situation. What went wrong? Well, the biggest thing is something that is most difficult to change, which is that our economic and health system is one of the most inequitable in the world among developed nations. And when you have so much of the healthcare system vested in a decentralized private model, you know, a coordinated response is difficult. The ability of people to feel like they can take part in the healthcare system when they, you know, aren't insured is, they're not even used to taking part in the healthcare system except when it comes to an emergency room, right? Those are challenges, right? And we'll come back to that because it factors, that inequality also factors really into the challenges going forward. The other thing that went wrong is just the investment in the state, and I would expect this is true nationally, in public health since the Great Recession is greatly diminished. 11 county public health labs closed since the Great Recession. Both vents, state vents, and mask supplies, and this has been, you know, disclosed. He's been very transparent. The governor's been very transparent by it. These state supplies, I wouldn't say were neglected, but they were just not invested in. And so we very much depended upon their supplies, and we still do, but we had to do things like redo the rubber bands on, you know, tens of thousands of N95 masks and things like that. And then I would also say that one of the other things that went wrong is the amount of press hype, right? We are undergoing what I would call the if things go wrong, the death throes of journalism. Even publications that are extremely reputable are forced to sensationalize to some extent to grab readers. And so they present data in a extremely misleading way. I'll just tell you one example, right? The big headline yesterday was coronavirus has killed more Americans than the Vietnam War. Well, that's not put in usually into any context. And the context is the Vietnam War was terrible for its participants, but number one, in the history of modern warfare, it was very low casualties. And number two, the number of people that are killed by 4 or 5 factors every year in the United States exceeds that of the Vietnam War. So you could have had a headline, insufficient exercise kills 4 times more people than the Vietnam War. Or you could have had a headline that said, car crashes kill almost as many people as the Vietnam War. Or you could have a headline that says, you know, smoking and tobacco related things still kill almost 3 times more than the Vietnam War. All of those headlines would have been just as accurate factually as what was done yesterday. But instead, you saw headlines about how coronavirus has killed more people than the Vietnam War. And I think it really poses a challenge on how we move forward as a society, because I think the rational thing balancing the number of people that can be hurt through coronavirus through the number of people who could be hurt through poverty and economic collapse, that is, to me, a discussion that you have to make, and you have to make precautions for, and you have to move forward with numbers and data in mind. Instead, what we see now, because of the press hype and because of maybe just what kind of political environment we are in, people are reacting by economic class or by partisanship on the question of whether we should reopen or continue the shelter-in-place order for longer. They're essentially making an issue that should be based on data into a partisan or a class-based issue, and I think that's definitely a challenge moving forward. So our challenge is how to get people back to work, avoid economic collapse and poverty, but to do so in a way that's relatively safe or safer, and that is that's going to be a real challenge. It's particularly a challenge with the great inequities that our society has, because I can tell you that the reactions that I get from the community, i.e. who wants greater levels of clampdown versus who wants to be able to get back to work, is largely dictated by your economic class and your age. But I would argue even more economic class and your partisanship. So, people have a tendency, if they don't like the president, that everything he says is wrong. And I do not think that that is a helpful psychological effect that we are all undergoing as we look into how to react to the crisis. And the other big challenge is, how do we in the county and the state of California, for that matter, react to and triage the lost? And I don't just mean those who have got coronavirus, but I mean triage the people who have lost their jobs, the people who are undergoing mental health issues, which are rising dramatically in the community, welfare, other triage mechanisms that we have in government. How do we triage with fewer resources? At the county, we are expecting at least a $40 million hit, and when on a given year the Board of Supervisors maybe changes about $10 million either way at most, sometimes much less, that is a substantial shortfall to do more work with. And it's particularly a challenge because we are going to have to move forward, we're going to have to do a lot more testing. And there's going to be some really good news that comes out. There's been a lot of work behind the scenes to try to expand testing resources, and that is really mandatory in moving forward. The other thing, though, I want to talk about is what the good news is, and Stephen, you could put back up that slide. The good news is that we're, for the first time, winning the fight against climate change, and the corresponding clean air benefits that yields. According to Caltrans, car traffic is down more than 36%. In some communities, I would probably think more. Oil prices are very down, which, number one, has a good positive economic effect. But as an environmentalist, I'm also happy that demand is down, and that and I'm also happy about some of the geopolitical effects of that. Low oil prices mean less power for cruel dictators around the world. Since early March, departures from California commercial airports have plummeted by roughly 65%. And here my my economic prosperity hat and my environmentalist hat wore a little bit, but obviously long distance air travel is one of the primary drivers of climate change, and so that's also a positive. Various researchers have between 4 and 6% drop of global carbon output this year. That doesn't sound like a lot to many folks, but this is also, fighting climate change is also a question of flattening the curve, and hopefully getting to a tail end of it at some point. And this is a substantial progress and the largest reduction in emissions in 40 years. And what I would argue, and I did a little op-ed in the Independent if you guys want to take a look at it or share it, is that this shouldn't go away when we open back up the economy. That a large proportion of this is things that we can continue to accomplish with while still getting back to work. I think that telecommuting needs to remain a feature of our society. And if your business has experienced a drop in productivity because of telecommuting, and I understand why, because the last time I did a talk of this kind, we tried to do it with my daughters outside the house, and in the background while I was giving a talk, you could hear murderous screams. That sounded like one of my daughters was being slashed by Freddy Krueger out in front of the front door. So if you're a business that's experiencing reduced productivity, I would say invest in some software and some Big Brother apps, because frankly, there are really good technology out there to make sure that your workers are actually at work. And I can't tell you how many people I know in town that are consultants for this or that, and their clients somehow think they need to fly everywhere and run up huge levels of billable hours and waste a ton of their money to do work. And hopefully this will cure them of a little bit of that, because I don't think any consultant is at their highest level of productivity when spending eons in airports as opposed to actually in front of a desk or a phone doing some work. And I'm mostly, I think the good news of this is that this is being done, again, not because government is enforcing on something, not because government has the coercive power to force you to drive less, but because we as a society have bought into the reaction to the crisis. And in my view, if we can make that much of an investment to avoid what was projected as hundreds of thousands of casualties, and then we can also make that level of effort for something that we all know that will create 170 million refugees and all the death and destruction that comes from that. So my pitch to you, if there's anything from my presentation that you walk away with, is how do we continue some of this good as we get back to work and open up the economy? And I think that is a really important thing to focus on, because one thing I've learned with the multiple fires that I have served you during, the debris flow and in my office, we feel, and in my district, we feel generally as a community, that we're just one natural disaster to the next around here. And I think it behooves us to make an investment in reducing the severity of the next natural disaster. With that, I would love to take some questions. And Stephen, you can put me back to normal mode.
Okay,
Thanks.
great. Thank you, Das. I've gotten a couple of questions in here through the chat feature directly to me. One, Das, and everybody can hear me, right? Yeah. Have you witnessed any collaborative responses or alliances that have formed that weren't there before? And what in that regard can you share with us?
Well, I think there's one of those partnerships that I've witnessed is super grassroots, which is this sort of movement of face covering makers, which is being well centralized and given a real boost by bucket brigade work. And I've had a front row seat because on any given night behind me, you will hear a sewing machine going furiously. And I'm feeling a little bit personally neglected, but my wife is saving lives. During the day, she's a psychologist, and at night, she is one of these guerrilla mask makers. And there are a lot of them here in Carpinteria. I mean, Carpinteria, we're only 14,000 people, plus about 6,000 outside of town. But we got a lot of mask makers. I'm sorry, face covering makers. Let me get the parlance right. Government has had the ability to provide sufficient N95s to healthcare workers in our community. And sometimes we've spared some. For instance, I got some to MTD workers when they were short, because I thought that would be also a big vector, possible vector. But we need to promote it a little bit in the general population. And that partnership has been great. I will only say, but that partnership is woefully underfunded. So if anybody wants to help, we can connect you with one of the 3 groups we know making masks, including the Bucket Brigade. I know firsthand they've shelled out money that they don't have, to get the job done. So it's a great partnership. Of course, it's a partnership with maybe 2 legs on it right now, not 3, and some folks in the community hopefully will step forward to provide that 3rd leg of funding.
Great, thank you, Das. We got another question here. Can you speak to the weak points in the system around our response, and what is needed to strengthen these weak points, other than the testing that you mentioned?
Yeah, I mean, I would say testing is obviously the first and foremost. Some small communities in the state have been able to allow everyone to be tested in their community. But these are communities that are very small, like Bolinas, 1,600 people. A philanthropist in town forked out $400,000 to do that. Now, if we did that in the county of Santa Barbara, it'd be $120 million. So if anybody has that lying around, please let me know, because we could use it. But I think that underscores my second point, is what we should learn from the weak point is that we need to have sustained investment in our testing and other equipment resources, and that and you know what that means. That means we got to pay for it, right? And so as a society, we need to know that taxes buy civilization, as Oliver Wendell Holmes once said, and that if we want all the trappings of civilization, including adequate public health response to pandemics, it means that we need to invest in it. And frankly, that investment went away because there was less tax revenue during the Great Recession, and it never came back to the level of pre-recession levels. I would also say that, well, if you're interested, I think there's interesting political science questions about all of this, right? The drivers in this crisis have not been the legislative branch of government, right? I mean, we get some stuff inserted in this, but we do so as stakeholders with maybe a little bit more voice than other people. And this is a complaint you get a lot in the legislature right now. It is driven by public health personnel. And so both the good parts and maybe some of the parts that we should question for the long run is how much of the reins of a society do you give to a technician? In this case, a technician in public health. They are a specialist. They are specialized at and know a lot about their stuff. And I think we, as decision makers, should listen to them with with very big ears. But I also question whether you want to hand over all of your society for months at a time to a technician. If we had done that to public health personnel years ago, we would have saved millions of lives from eating too much meat as a society, from smoking too much tobacco, and from not exercising enough. So, what are your well, what's a problem with that? Well, maybe we should have handed society's reins and decision-making over to public health personnel years ago. We would have millions more people around. But is that level of command and control what we want as a society? And I think that's a political science question, and it's a question for the people of this state and nation to answer. And I think it's a really important thing going forward, because I don't care who is at the press conferences. It is not even the executives driving the response to this crisis. It is public health personnel. And the rest of us, including your legislators, are being swept up in that, and we may have able to be correct the course a little bit, but we're not driving it. And I think that's a question you, as a voter and as a member of the society, have to go, okay, is that the society that I want to live in?
Okay, thank you, Doss. We have a question from Carl. Thank you for this, Carl. He said a lot of our economy is tied to tourism, which is one of the drivers of traffic, particularly air and automobile traffic. How can we bring back tourism without also bringing back all the traffic?
Well, I think that's an important question. I do think a certain amount of tourism is not automobile dependent, and I think that we need to continue to push that component. Weekend trains are really crowded on a normal piece of business. I'm not saying right now, but in a normal basis, weekend trains of people coming from Southern California into Santa Barbara are packed. And that is when society returns to normal or some semblance of normal. Having a lot of people come up in trains is a good thing for us ultimately. I would say, though, that my other critique, Carl, is that we as a county should not be as dependent upon tourism as an economic driver as we are. And what does that mean? It means that we need to support, defend, and promote jobs and industries that pay wages that do not exacerbate our jobs housing imbalance, that where people do not have as much of a gap, because it's not just the tourists coming in. Unfortunately, the data is really clear that our housing prices and the combination of the kind of jobs we have here and our housing prices mean that more and more people are commuting farther and farther to their jobs. So it's not just the tourists creating the traffic, it's all the workers that are commuting to work every day to serve them. And that is just not rational policy. That is not a rational way to construct a society. And to a certain extent, we can't just break it down and reconstruct it, but we have to shape it going forward so that we are not as dependent upon low wage jobs as a community. That's my opinion. Great. Next question.
Next question from Linda LeBrock. She's asking, do you think the governor will take a county by county approach to reopening the state?
I do not know for sure, and neither do even some I think some folks close to the governor, but he has given every indication that it will be a county by county approach. His language at the press conferences and his sort of outlining of a structure really lend itself to a county by county approach with some conditions, I think. And I think some conditions might be appropriate, again, because I do not want to see a partisan breakdown, right? Where Republican communities go, hey, we're going to return the economy completely back to normal, and Democratic communities decide to continue a stay-at-home order longer and longer and longer. That doesn't make sense for us as a society to break along partisan lines in a public health crisis. And so again, that I hope the governor is therefore driven by data and neither by the alarmism of one side or the desperation of the other.
Great, thank you, Das. I was reading in an article from the New York Times yesterday written by Susan Rice, former National Security Advisor, and her title essentially was, "It's not enough to just get back to normal. We need to rebuild our society better." And I was thinking I was going to ask a question like that, but Carl Palmer has asked essentially the same thing. It's what changes are in place now being forced by COVID do you think will serve as the seeds for bigger changes that we need coming out of this?
Well, I think the biggest one is we don't need to drive as much. I mean, it's just real clear that our society can function on less driving. I mean, I think it's really interesting that for years, both opponents of environmentalists and environmentalist groups themselves have undervalued how much people could actually make a change. The opponents of environmentalists have said, well, human beings won't, consume less. And the environmental groups themselves have found it generally more convenient and more easier way to mobilize people to blame everything on the oil companies or Donald Trump or back in the 80s, it was the Secretary of the Interior. It's just easier to blame things on the bad guys. But when you get to the heart of an environmental issue and you get to the heart of our challenges as a society, is we're the bad guys, right? Or at least there's an aspect of what we are doing that is creating the bad effect, and that the more introspective we are about that, and the more we are willing to address our contribution, the better. And so for years and years and years, both sides have been saying that consumers can't make the change and can't turn around pollution and climate change. And lo and behold, they just did, right? You know, I would say the things to walk away from is take longer vacations, but fewer ones, or ones closer to home, right? That is a big driver of emissions. The other is try to convince your manager or employer to telecommute more often. And which is, you know, this is a little bit at war with a little bit of my creeping out of Big Brother apps. Even be willing or to use some of the software out there that makes sure that workers actually are working, or that their employer or supervisor can monitor and see that they're working. A willingness to do that, I think, is going to be important moving forward. It will keep us safer from what will be an ongoing public health crisis. We will not be through this until there's a vaccine, and that is sometime in 2021 in all likelihood. And so moving forward, both to help the environment and to make sure that there is less infections, will necessitate us living a little bit differently. And I think telecommuting, shorter distances in vacations and fewer of them, but hey, just go longer. There's nothing sacred about the 7-day vacation that Americans do. I mean, everybody else in the rest of the world thinks we're crazy that we would take a vacation for 5 days or 4 days or 7 days. And maybe we are. I think those are some of the changes. I do think that there's other ones that the crisis doesn't accentuate, but that we should accentuate, and that is electric cars, including used electric cars, which are ridiculously cheap, and you know, diet changes of things that are you know, that drive climate change as well. I hope that answers your question, Carl, but I just also don't want us to lose Jan Vissel's question too.
Yeah, Jan is saying, and I'm reading these out because I see that you're reading too, Dus, but I want to read them out loud for the recording for posterity, because there will be some people that are going to be looking at this later. But so Jan Vissel with the engineering department of UC Santa Barbara asked, while the extent of coronavirus here is unknown, it's reasonable to assume that it's going to persist for some time into the future, possibly a year or longer. Where does the county's planning stand with respect to subsequent waves of infection that can be expected to follow reopenings?
So the short answer and most important part of the answer is that we fully expect to have to loosen and also tighten in response to changes. That is something that in the planning we understand and are preparing for, and that maximizing testing resources is really vital for. And so that's going to be a real challenge. We're going to have to up staff right when we're dramatically reducing revenue, and that's a real challenge. I think the other is the other part of the answer to Jan and to Carl. The deeper part of the answer is that the public needs to understand the extent of their power in this, right? Both in the changes that we should make going forward as a society to be a better society, and in the maintenance of social distancing. This crisis shows that the public in their habits and changes thereof still drives our society. As much as it's convenient for us sometimes to think that government or governmental leaders or big business are sovereign, it's really the people and the consumer that is sovereign, and they're not sheep, and they respond to crises, and they respond to calls for action, and they also need to get out of the house occasionally, right? So, I mean, there's a balance here that if we were going to try to maintain the hardest line stance that government could maintain, we wouldn't even have the personnel to enforce it. And if the public stops buying into it, we will have a much worse situation. And so I think it is appropriate for us, both because of the health effects of poverty and because of the importance of maintaining the public's willingness to change their habits based on our call, to also modify our stance with proper precautions in place.
Great, thank you, Dus. Jonathan Gardner has asked or made a comment. Rahm Emanuel said a crisis is a terrible thing to waste. What makes you optimistic about our community's response to this current crisis?
Well, I think typical Rahm, somewhat crass, but very true, but right square in the middle of the bullseye accurate, is, yeah, I mean, there are things that this is making us do that we should have done long ago. Of course, there are things that once we are through the public health crisis that we need to address, because human contact, we are a tribal species. We're descended from we have millions of years of need for each other, and of course that's also a lesson that we're gonna that we should remember from this, and reverse as soon as we can, because it's a deep need in us. But I think that this crisis should make sure that we change systems and put in place some of the systems to make our economy sustainable from an equity standpoint and from an environmental standpoint into the future. One of the challenges of that, to address Carl's other question, is in food systems. What we're finding around the nation is people are buying more food online, and they're buying more unhealthy processed food. You'd think if they're spending all this time at home that they'd cook more, but they're not, because they're very much used to people in their community cooking for them. And so we could walk away from this crisis by highlighting and localizing food, eating more sustainably grown agriculture, maybe eating less meat, and I'm a big fan of high quality coffee and chocolate, but maybe just a little bit less high carbon, high slave labor chocolate out there. There are things that we could do to walk away from this as a better society, and I hope we keep those lessons in mind.
Great, thank you, Dus. Here's a question from Ivor John, one of the top climatologists in Santa Barbara County, if not the state of California. He's asking what the county can do to help businesses position themselves and be ready to take advantage of the stimulus funding that's going to be available during the recovery phase.
Yeah, I mean, I think that there is a lot that the county can do. A lot of it is helping to channel people to the right resources. And it's somewhat duplicative of a lot of the things that business groups are also doing. But maybe if we all get those things out, then we'll be in a better position. You know, the county was just hosting this morning a business assistance webinar with topics that include banking and the loan environment. There's a lot of support from local chambers and Weave. The Q&A and a video of the webinar, by the way, will be posted at readysbc.org. Of course, that's also a good website for you to know more about coronavirus and more about emergency response in Santa Barbara County. The Economic Development Collaborative holds weekly webinars. There's one you just missed because you spent time with me. But let's face it, the federal aid, okay, in our society, because of what we've chosen to have as a society, we have a public sector that's this big and a private sector that's this big. You can take a massive amount of the public sector, and if you divide it over all of that private sector, it's going to be too small of chunks. No matter what, it's going to be a Band-Aid. There's no, as much as elected officials want to be the ones riding on the white horse and saying, hey, I'm going to save you business, I hope they are, they're either, in my view, they're either telling you a lie or they're lying to themselves. There is no substitute in a business for customers and for getting back to work. There just isn't a substitute that is going to, and so I, to me, it's better to be really honest with folks and say, we've got to come up with the framework that allows people to get back to work safely, or at least safer, and prevent the collapse of the economy at the same time. And I would say to, people who would critique that as choosing, money over lives, I would just say, hey, do you know somebody who's grown up in poverty? Because, I do, I have. And poverty is a tremendous impactor to the life expectancy of children growing up in it. And if we undervalue those kids, I think we're doing a real disservice to public policy. So I think that, I think that is the challenge moving forward.
Okay, so we're right up at the top of the hour. I want to just give one more question to you, Doss, if you don't mind staying on for another minute.
Sure.
But Joan has asked a question to me, and I want to just relay it to the group. She's saying we should refer to confirmed cases with very limited testing, not cases, but ensure we release the fact that the tests are still inaccurate, and really talk more about asymptomatic spread so that people understand. Joan also wants to know why we're not using our large public rental facilities for those people that might need them that are living in dense housing.
Well, I'll tell you that because the challenge has been just to address populations of congregate living, extreme congregate living. And so the county has done things that it really isn't equipped to do, which is, in this community, how long did it take for us to, as a community, come together and open a homeless shelter? Years. And then just a couple years ago, we lost it. So we don't even have, before this crisis, we didn't even have a homeless shelter. And yet the county has been able to get 2 homeless shelters, one in the north, one in the south, going in under a month. And, you know, you would hope we would live in a society where that was possible, but history has not shown us that that is very easy to accomplish. And so that was sort of the priority. We now are have a non-congregate homeless sheltering system in the South County, where we're have hotel beds for folks who are over 65 and have pre-existing conditions and are homeless. And in the north, we have a congregate facility. I would say that we just don't, I mean, the public housing resources we have are fully subscribed and have waiting lists that take people years to get through. So I'm not, maybe a clarification of the question would be helpful, because we don't have extensive public resources for housing. We have, you know, compared to other communities we do, the city of Santa Barbara, 13% of our housing stock is public price-controlled housing, but the waiting list is years for people to get through, not extensive. We have augmented that with hotel rooms, and that's been helped by state funding, but our capability in the long run is limited to the fact that we are trying to do much more, but without any transit occupancy tax, with much lower sales tax, and with other financial hits that will hit public safety. And really the only good news in terms of revenue and the economy is that the marijuana tax and marijuana employment is going to be one of the only things that helps get us through as a community. The only way that we are going to be able to maintain your public safety services is to dramatically depend on the marijuana tax going forward. Before, we were using it for stuff like libraries and sustainability and legalizing solar in the county and things like that. Now we're going to have to use it for your basic public safety services like sheriff and you know, DA and basic things like that.
Great, thank you, Doss. Well, it's 5 after 2. I think we want to just express our gratitude to you as our guest today. We knew you would have some unique insight and fantastic perspective, Doss, and you did not disappoint, as you never do. So thank you so much. Any closing thoughts? Just,
you know, if we didn't address something, or if I got the meaning of a question wrong, feel free to email me. I'm dwilliams@countysb.org, or go check out our county website and get to know me and my staff. Darcel and Katie work tirelessly for me and for you. And so you have a staff of 3 in the 1st district, me, Katie, and Darcel, that are working hard for you. And we also try to draw upon the whole of the county structure to help us serve you. So it's an honor to serve you, and don't be shy. Great. Thank you so much, Doss. Thank you. Okay, y'all have a good afternoon.